Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome back, everyone. Today, we're jumping into something really fundamental for mental health pros, choosing the right telehealth platform. It might seem like just another tech decision on a long list, but honestly, it's way more than that. It's really a core competency. It affects pretty much everything: client safety, how you connect, even therapy outcomes. So the big question is, how do you make this crucial choice wisely? How do you avoid just getting lost in all the options?
That's exactly right. And for us as professional counselors, picking a platform isn't just about, what's easy or what's cheap. It's fundamentally an ethical responsibility. We have to make informed choices about technology, always putting the client's well-being first and foremost. So in this deep dive, we're aiming to give you a solid framework, a kind of roadmap for selecting a platform, really getting beyond just the surface stuff.
Okay, so let's unpack that a bit. This idea that the platform is more than just like the plumbing, it's part of the therapeutic environment itself. How exactly does this digital space shape the actual therapy work we do?
It's a huge connection and, often kind of underestimated. Just think about it for a second. The platform's features, its reliability, they directly impact that therapeutic alliance. The core relationship you build with your client. It influences how engaged they are, how much they participate, and, ultimately the treatment outcomes.
We've all been there, right? That frustrating moment when the video freezes or the sound cuts out.
Exactly. And it just pulls you right out of the session flow. There's actually research showing a direct link between those tech glitches and a weakening of the therapeutic bond, which is, pretty sobering when you think about quality client care. So this decision, it's not just tech. It's integral to your effectiveness as a therapist. And it touches on client safety, staying compliant with regulations, and honestly, the sustainability of your whole practice.
Wow, so it's like this invisible factor in the room influencing things constantly. And you mentioned ethics. This isn't just good practice. It's tied to our professional obligations, isn't it?
Oh, absolutely. The ACA Code of Ethics, specifically in Section H.1.A, it clearly states that practitioners need to develop knowledge and skills about the technical, ethical, and legal aspects of telemental health. So it's not optional. It means we really have to systematically evaluate these platforms, use evidence-based criteria, not just, grab the first one we see or the cheapest one.
A systematic evaluation. Okay.
Yeah, and one helpful framework here is something called the technology acceptance model. It sounds complex, but the core idea is pretty simple. Basically, people, both providers and clients, are more likely to use technology effectively if they perceive it as genuinely useful and, importantly, easy to use.
Makes sense. If it's a hassle, you just won't use it well, or maybe even avoid it.
Precisely. If it feels clunky or difficult, adoption drops. And so does its potential therapeutic effectiveness. It's about aligning the tech with how people actually work and interact.
Okay, so a systematic, intentional approach is key. How do we actually do that, though? How do we cut through the marketing hype and figure out what really matters? What are the real nuts and bolts we need to look at when comparing these platforms?
Great question. Let's dive into what I think are the core evaluation domains. First, and this one's really the top priority, is clinical effectiveness. The platform absolutely must support building and maintaining strong therapeutic relationships. That's job one. Meaning high-quality audio and video are non-negotiable. You need to see nonverbal cues clearly, hear the nuances in someone's voice. If the connection is poor, if it's breaking up, you're losing vital clinical information. You can't properly assess emotional states or maintain that feeling of presence.
Right. Just like in an office, you need to be able to see and hear properly.
Exactly. And beyond just the basics, think about features that help you do your actual therapeutic work. Can you easily share documents like psychoeducational handouts? Is there screen sharing for collaborative exercises? Maybe breakout rooms if you do group or family work? These aren't just bells and whistles. They enable different kinds of interventions.
Okay, so functionality tailored to therapy. Got it. Now, what about the flip side? Keeping all that sensitive client information secure, that feels like a huge area of concern.
Huge is an understatement. It's an absolute ethical imperative and, of course, a legal requirement. Security and privacy protection is critical. This means looking for robust encryption. Specifically, you want end-to-end encryption. Think of it like a sealed envelope for your digital conversation.
Okay.
Only you and your client have the key to open it. Even if someone intercepted it, it would just be scrambled nonsense. It provides that fundamental privacy.
And beyond encryption.
You definitely need multi-factor authentication. That's that extra security step, like getting a code sent to your phone, not just relying on a password. It's like having a deadbolt and a regular lock on the door.
Makes sense. More layers of security.
Precisely. And then, of course, there's IPA compliance. This is massive. You need to ensure the platform provider will sign a business associate agreement, a BAA. That's their legal promise to protect health information according to federal law. And the NBCC code, Section 93, also reinforces this need for secure platforms. You also need to ask questions about where data is stored, what their backup procedures are like.
Yeah.
It all ties into protecting your clients.
That's a lot on the security side, but clearly essential. So, okay, we've secured the data fortress. Now we need to make sure the bridge to that fortress actually works reliably, right? Because nothing kills a session faster than the tech failing.
You said it. Technical performance and reliability have a direct, immediate impact on the quality of the therapeutic process itself. We're talking about platform reliability. Often, this is measured by things like uptime percentage. How often is the service actually available and working? And service continuity plans.
Uptime percentage. Okay.
Think of it like the electrical grid. You need it to be on almost all the time for things to function. If the platform is constantly down or glitchy, it just erodes trust and disrupts treatment continuity.
Yeah, that would be incredibly frustrating for everyone.
Absolutely. And beyond just staying online, think about bandwidth adaptation. Can the platform adjust to varying internet speeds? This is super important for clients in rural areas or places with less stable internet. And also, cross-device compatibility. Clients need options. Can they join easily from a smartphone, a tablet, a computer, whatever works for them?
That flexibility seems key for access. And speaking of access, there's a big ethical piece around making sure everyone who needs help can actually use these tools, isn't there?
Yes, absolutely. Accessibility and inclusion are fundamental ethical commitments. We need to be thinking about digital equity. That's the principle, that everyone should have fair access to these services, regardless of their income, where they live, any disabilities they might have, or even their comfort level with technology.
And that ties into the ethics codes, too.
Directly. ACA standard C2.A talks about non-discrimination. So platform design has to consider users with disabilities. We're looking for features like closed captioning for those with hearing impairments, compatibility with screen readers, which falls under WCAG compliance, and options for keyboard navigation.
WCAG, okay. Web Content Accessibility Guidelines.
Right. And think broader, too. Multilingual interfaces are important for reaching diverse communities. Mobile optimization is crucial since many people rely primarily on their smartphones. These aren't just nice extras, they're about making sure our services are genuinely accessible to the people who need them.
Wow, okay. We've covered a ton of ground on what to look for. Clinical effectiveness, security, reliability, accessibility. So, putting it all together, how does a practitioner actually do this evaluation? What's the practical process look like? And then, inevitably, we have to talk about the cost.
Right, the practical steps. A systematic evaluation means looking at this multidimensionally. First, clinical functionality. Does it have the video quality, the audio, the tools you need for your specific way of working? Then, user experience. And this is for both you and your clients. How easy is it to log in? Is the interface intuitive or confusing? What kind of technical support is available if something goes wrong?
Good point. Support matters.
Definitely. And then critically, integration. How well does this platform talk to your other systems? Your practice management software. Your EHR integration connecting with electronic health records is often a big one. And billing software too. Sometimes this involves something called API integration, which is basically how different software programs share information securely.
API integration. Okay, so making sure it fits into your existing workflow.
Exactly. Avoid creating more headaches for yourself.
And then, the money question. Costs. This all sounds potentially expensive. How do practitioners balance these high standards with, budget realities?
It's a very real consideration, no doubt. The key here is to think about the total cost of ownership, not just the sticker price per month.
Total cost of ownership. Explain that.
It means looking beyond the subscription fee. What are the costs for implementation? How much time, which is money, will training take? Are there ongoing maintenance fees? What if you decide to switch later? Are there costs involved in moving data? You also need to watch out for hidden costs. Things like transaction fees if you use their payment processing, or extra charges for more data storage, or maybe need to pay premium for features you thought were standard.
Ah, the fine print.
Always read the fine print. Now, doing a cost-benefit analysis is smart. Weigh the costs against potential benefits like reaching more clients. But and this is crucial.
Yeah.
Financial considerations can never justify compromising client safety, therapeutic effectiveness, or regulatory compliance. Those are the absolute bottom lines. Client well-being and your ethical duties always come first.
That's such an important point to hammer home. It's easy to let price drive the decision, but those non-negotiables have to stay non-negotiable. Okay, so let's say a practitioner has done all this homework, weighed the options, and picked a platform. Is the work done then? Or is there more?
Oh, definitely more. Selection is really just step one. The next phase is implementation. And that requires, again, systematic testing and quality assurance. When you're in a trial period or first starting out, test it thoroughly. Use different devices, your laptop, your phone, maybe a tablet. Test it on different networks if you can, like your office Wi-Fi versus home internet.
Really put it through its paces.
Exactly. Test the features you plan to use. Does screen sharing work smoothly? Is the document sharing easy? And test the security aspects, make sure encryption is active, check the login process. And critically important, get feedback from your clients during this phase. How was their experience? Are they hitting any accessibility walls, any technical snags? Their input is invaluable.
So it's not just about your experience, but theirs too. Makes sense. It's a constant refinement process then.
It really should be. And this whole process, evaluating, selecting, implementing, getting feedback, it all ties directly into our ongoing professional development. Keeping records of why you chose a particular platform, how you tested it, what the outcomes were, that's valuable documentation. Well, it serves as evidence of your systematic approach, your professional judgment, your ethical decision-making. It can support getting certifications, like the BCTMH. It shows you're meeting continuing education requirements, and it demonstrates ethical technology use if your licensing board ever asks. Plus, honestly, just doing this evaluation sharpens your critical thinking skills. You get better at navigating the tech landscape, which is always changing. And this competence in selecting appropriate tech aligns with broader standards too, like the KSRAP, pronounced KCREP 2024 standards for counselor education programs.
KCREP, got it.
Yeah.
So it builds essential skills for the modern practitioner.
Definitely. And one last piece here is ongoing attention to regulatory and compliance issues. Remember that rules can vary state by state, especially if you practice across state lines. You need to know the rules about data storage location, specific encryption requirements, maybe even platform certifications in certain places.
Oh, right, state-level differences.
Yeah, you have to verify the platform meets all applicable state laws and licensing rules where you and your clients are located. And these rules change. Federal privacy laws get updated, state telehealth policies evolve, professional standards shift. So you need to do regular compliance reviews to make sure your platform and your practices are still up to date. It's about protecting clients and protecting yourself professionally.
This has been incredibly thorough. It really drives home that picking a telehealth platform is so much more than just a tech choice. It really is a core professional skill, and taking that systematic, evidence-based approach you've outlined ensures the technology actually serves the therapy while keeping everything ethical and legal. That feels absolutely foundational today.
It really is. And, this journey of learning and adapting in telemental health, it's continuous. Embracing this kind of systematic thinking helps ensure we evolve responsibly as the technology itself evolves. Which kind of leads to a final thought, or maybe a question for you listening. How will you actively take this knowledge and integrate it into your own practice, into your professional growth going forward?
That's a great question to reflect on. And to help with that, as you think about today's deep dive, maybe consider these two questions first.
Yeah.
How might these core evaluation domains we discussed, clinical effectiveness, security and privacy, technical performance, and accessibility, how might they specifically shape your next steps when you're looking at or maybe reviewing a telemental health platform you already use?
And second, thinking about that emphasis on ethical responsibility and digital equity, what's one concrete action, either personal or professional, that you could take to help minimize technology barriers for the diverse clients you serve or hope to serve?